welcome to the Newsroom India. I'm your host Mehak Bharti, and today I'm very thrilled to interview Dr. Haleema Yezdani. She is not only the Vice President of HIMSS but also a globally recognized healthcare influencer. Yes, you heard it right. Healthcare influencer with WHO, World Health Organization. And today we'll be talking about something that's on top of everybody living in Bangalore right now. You heard me right. I'm talking about the havoc caused by the heavy rains. Dr. Yasdani will be sharing her expert advice on how to stay safe and maintain proper hygiene during this tough time. We welcome you to the conversation, ma'am.
Hi, Mehak. Good evening, everyone, and thank you so much for getting me in. And yes, of course, the rains are causing havoc. There were days when we were praying that we should have rains in Bangalore. We were all tired of the heat. But I think now it's time that we say, rain, please give us some time to breathe. I think, yeah, that's where we are now.
So true, ma'am. So, ma'am, since we all know that the rain hasn't stopped since the day started, so we have few of the questions that we would like you to answer for us. As you know, health is one of the major issues that people face during times as such. So, what are the
Definitely.
common illness people might face or suffer due to this rainy season?
Yeah, of course. Any untimely climate change has its repercussion on health. That's a very, very important criteria that health disturbs everyone's health. The first thing that I could talk of is influenza and any kind of viral infections. They do spread rampantly during this rains like this. And secondly, any climate intensity, like as in high summer or this kind of rainy season, can precipitate gastrointestinal infections like vomiting, diarrhea, food poisoning, and stuff can increase. Then we could have outbreak of diseases like dengue, rickettsia, and these things which are spread by vectors, by sandfly, by mosquitoes, and all. So those kind of infections also can be on the peak right now, and we could also think of very different kind of infections, skin infections, allergies. So I think everything is going to spike up right now. And even if not now, during the outbreak of the monsoon or during this untimely rain, it may happen immediately after the rain stops. Because at that time, once there is a calm, that's when people would see the repercussions. And we health experts might anticipate a rush into the OPD with severe fever and the different kind of infections, allergies, flare up of asthma, and varied complications during the rains.
So, ma'am, as you mentioned, so many names that sound scary. So, how do you think people can get prevented from those diseases?
The first and important thing is hydration. I have
Yes.
told time and again during this thing that during the rainy season, summer time, of course, we drink enough water because the body tells us that we are thirsty and we do drink water. But when it is raining and when it is cold, that's time we don't feel the need to drink water because we're already kind of saturated and we don't, we don't in fact get the urge and the thirst to drink water. At this time, I would say maintaining a timeline of your water. Yes, you heard me right. Maintaining a timetable for your water would definitely help because water intake is one such thing that will help your toxins to get out of the body at the earliest. It'll help all the all the bacteria that's kind of built within us during this rainfall, and whatever we have taken in so far or 24 hours, it helps us to push it out of the body at the earliest. So the best way is first thing increase your water intake. Secondly, and the most important thing, though people crave for chats or street food during this time of the climate. Of course, all of us are feeling that it's raining. We have to have something very nice and all that. I would say stick to your home food. Kindly don't venture out to get street food. We are going to have a lot of complications. We may have hepatitis, we may have gastrointestinal disorders if we are taking the street food right now, because the water source could always be contaminated. Be very careful about your water source because that is the primary reason that you're going to have infections. And secondly, it's also very important to have a very high amount of vitamin C in your body that will help to prevent your kind of increase in the infections. It will help to get up your immunity to be more precise and take a lot of dry fruits to will build up your immunity in the other front. Like how we in fact fought COVID, trying to
Yeah.
build ourselves more stronger. So I think these 4 5 days are going to turn out to be the same. So drink a lot of water, hydrate yourself well. Don't eat any raw food from outside. Have home cooked warm meal, and also be very careful about your water source. Make sure your purifier is working very well, and no harm in boiling your water again and drinking that because we are fearing water contamination because the amount of drainage issue that we are facing these days, we could always think of any kind of contaminated water that we could be drinking. So I would say be very careful with the water source. Make sure that you are aware of what you're taking and what you're taking inside your body at this time.
Ma'am, I truly agree with you, but then again and again I heard one thing: home cooked warm food. But then what about the people who live in PGs? What about the professionals who keep on traveling from one place to another for
Right,
work experiences?
right.
So they can't be having home cooked food, right? So
Yeah,
what
these
precautions
days
should
could
they
be
take?
these days could be difficult for them because definitely home cooked food is something that they would not be no kind of, I would say, fortunate enough to get it. But then again, we have our own other sources to be well equipped with immunity. You can have more of dry fruits. You can increase your intake of juices. I would say yes, but again, having I would prefer homemade juice than making it outside or drinking it outside. Again, the same thing as water contamination. Be sure about your water source, and then you can make good juices, and especially oranges and mosambi, which are very good in vitamin C. Guava is a very good source of vitamin C. I know I told you that always have cooked food, but in that fruits I think are definitely a source of vitamin C to boost your immunity. So make sure you wash them thoroughly before eating them and before having them. And of course, along with that, we can always have ready food which is available on the market, but not, of course, the restaurant one, not the one which is being served there. You can go ahead with having simple. Even if you can even boil yourself an egg, if you are a non-vegetarian person who has non-veg food, if you can find a source somewhere to boil yourself an egg per day, that will in fact give you the entire day's protein requirement, and you could basically be at par with other people who are enjoying their home cooked food. Or in fact, vegetarian people can boil some if you just have water and a vessel at home or in the PG area where it's accessible to you, you can just put in some khichdi or something. It doesn't have to be a tasty meal. At this
Yes.
point in time, we are going to focus only on healthy meal, because I'm sure people would agree with me when I say that uh, every tasty meal is not healthy and every healthy meal is not tasty. So either which ways is not true. But very, very important that you at this point in time we concentrate on your health than our taste buds. So I think yes, you can boil yourself, put in all the dals together, put some rice together. It just takes 5 minutes to put in a cooker and give a steam and have that. I'm sure the PG would be having some kind of maybe even an induction stove or something in your room. That will be more than enough. That will basically help you to stay off the restaurant cooked food. I'm sure the hotel people or restaurant people are going to penalize me for saying this, but I think during this time it's going to be very important that you have something which is good and home cooked, and in fact you can make small even as I would say variety is not required, but the right thing is definitely required this time. Yeah.
Ma'am, but there are a lot of canned food, like already packed foods or pre-made food that we just need to boil and it gets cooked. So are those foods good to have or no?
At this point in time, or the situation that we are in, yes, I think that will be the go-to food now. But generally, if you tell me if that's safe to have, no, not in the long run. But in the 4 5 day situation that we may face, I think that will be the best thing to go to than going to the restaurants and having what is made now. Again, the whole thing boils down, Mehak, to water source and water contamination, because I am very sure we're going to be facing trouble with that. So make sure you boil your water, you cook your food, reheat your food, but make sure that you in fact cook it before you have it and consume it. And ready to eat food, I think with MTR we have so many packets, so many different kind of foods. We have even curry out there, but general time I would not recommend people to eat that because the number of preservatives will be added. We'll have a lot of other I would say chemicals added for preserving the food. But at this point in time, when the situation is like this, that will be the go-to meal. PG people and people who are living away from their house.
Ma'am, the
Yeah.
contaminated water that are present on the streets are similar to honey for bee. So these contaminated water calls for dengue and malaria. So how do
See,
people?
we recently had a dengue outbreak. I'm sure Mehak you're aware of this.
Yes.
Before this entire thing started off, we had people pouring in with dengue fever. Like it was too much of a kind of. I would say it was more or less like it declared an epidemic in this part of the state. But now we're going to have a redo of it because the water puddles are contaminated. And at this time, we're going to have breeding of the mosquitoes, which already it was existing. And we were, in fact, seeing it thin down and we were seeing the cases disappear. But I
Yes.
think now, after this particular contamination and this puddles with the garbage which is being accumulated outside, so we are just looking at a bomb around the corner. So we may have start off with again dengue fever, rickettsia, leptospira. I think all these kind of infections are going to peak up again during this time. So I would again request people be very safe when you're driving home or you're going. I'm sure many of us don't have the luxury to stay at home or work from home. So we may have to venture out, go to your hospitals or go to a clinic wherever we are working. And many of us who are in essential services will have to get out of the house and do our jobs. But ensure that you're well covered and if possible, wear rain boots when you're going out because the water slush, the I would say the muddy puddles which you splash on you that can basically have rodents, urine, and many contaminating stuff that can infect you. Can have skin infections. You can have allergies, eczema, and plus other parameters of evading the barrier of your blood, and it can basically cause other infections. So make sure if at all there is a splash or something like that with muddy water that's in the puddles, make sure you scrub yourself with soap and water, come back home and have a good bath. That is definitely very important right now.
Ma'am, is there any medicine or spray that you would like to recommend to the people?
First and foremost, use mosquito repellents. When you have children and elderly people at home at this point in time during this rain, I'm sure when people tell me that they're allergic to the mosquito repellents, there are people who are allergic to the smell of it or to I think I would say just that is the secondary thing right now. But make sure that you use it, very well. During daytime, especially when the dengue mosquitoes would be at the peak, they would basically be acting at that time. So use mosquito repellents. You can also use creams like odomas that will also help you to keep the mosquitoes at bay. When you have elderly people at home and children at home, be very careful with mosquitoes and other flies and vectors which are distributing infections out there. So use that. And medicines wise, yes, go ahead with vitamin C. Start back on your multivitamins. And people who are having diabetes and hypertension, be very sure your sugars are under control. Talk to your doctors, talk to the people whom you are seeing for your diabetes. Make sure that they in fact get your sugars under control at the earliest, because at this point in time if the sugars are haywire, you are like a inviting reservoir for all the infections. So keep your sugars under very good control at this time, especially people who are not monitoring or kind of taking, okay, I already am on medicines on for diabetes, I may not require monitoring. So for them I would make one point very clear: please check your sugars regularly. Make sure your levels are well within normal range to prevent any kind of undue infections during this monsoon, during the season right now.
Ma'am, what are the normal levels that one should maintain?
Ideally, I would say if random is below 140 and HbA1c is what we usually target. That's the 3 months average of the sugar. And I would recommend people maintaining it below 7. People who are diabetic below 7. And of course, if you are below 6, that's an excellent thing that you could always be pre-diabetic and non-diabetic with the medication. That's a very good thing to achieve. But below 7 is a very good range to achieve. So if you're in that range, be rest assured you'll not have any acute or severe infections. But yes, of course, if you are beyond that or below, I mean, much above that, one very, I would say heartfelt recommendation would be get your doctor at the earliest, either phone call or in-person visit, whatever you could make of it. Please go and talk to them and discuss the medication plan with them, and please start off with medicines later.
So, ma'am, rainy season in general affect many respiratory conditions such as asthma and allergies. So, what can be done to manage these conditions effectively?
People who are asthmatic, people who already have a COPD, bronchitis, and these kind of respiratory issues, first and foremost, make sure you have your flu vaccine on time. Any kind of influenza infection or any flu for you at this point in time could be disastrous. It can lead to pneumonia. It can lead to respiratory complications, which could basically be detrimental. So please make sure you take your flu vaccine on time and be very safe. Wear your mask if you're venturing out, and keep your inhalers handy. At this time you will be bound to have allergies, eczema. You'll be bound to have allergic asthma, wheezing, cough, and all these things. So make sure you have your inhalers with you with full I would say keep it handy and keep it full. Make sure you keep your medications in stock at home. That's very important thing to do, because what happens suddenly your nose can get closed. You could have clogging in front of your nose. You may not be able to get out to get your get to the pharmacy to take your medications. So
Mm-hmm.
make sure till that time you have your medications in stock at home. Inhalers, insulin injections, and medication that you use for your common or chronic conditions should be stocked at home always. And if
Ma'am,
you have
are there.
children,
Yes.
yeah, if you have children, make sure you have your general medications like medicine for fever, medicine for cold, medicine for gastroenteritis or vomiting and nausea. Make sure you have these basic things at least. And after that, of course, you can talk to your doctor and get the medications whenever you can.
So, ma'am, other than these medicines, are there any other measures that they should take care of, like yoga or any exercise or any food habit
I
that
would
they
say
can
elderly
really?
people, it's very difficult to know. I mean, yeah, if they are used to doing yoga, please continue that. And breathing exercise also can help to keep calm, and meditation can help to keep your mind off these things. I would say don't watch news. That will be another painful thing to see because the roads are badly clogged and we
Ma'am,
will
you're
end up seeing
taking
swimming
away
pools
our
everywhere.
ma'am, you're taking away
Yeah,
our jobs, ma'am.
sorry. Your
You're
jobs?
taking
No,
away our
no.
jobs. If
No, I
people
mean,
would,
just don't watch news as in not the informative stuff like this. I would say don't watch the stuff wherein people are telling that don't go out, they're going to have issues. I mean, yeah, of course, try and lead a normal life, try to get stress off from you, and be as relaxed as possible. Breathing exercises do help in that time. Try doing that. Meditation also adds on to relaxation. I think that should also help.
so, ma'am, are there any cleanliness and safety drinking water and food that one should follow? Because, see, living in a PG, we never know that what kind of water is being used to prepare the food. So, are there any measures that
See,
we
that's
should
what.
take?
If you have boiled your food, as in if your food is well cooked, there's no concern about it. Usually, water, even though it's contaminated, if it's boiled well, it shouldn't cause any havoc or any issues. But again, if you are drinking your water with unknown source and you're not sure if your RO is working or not, and you're not sure if your filter is cleaned or it's functional at all, then please boil your water and cool it and then drink the water. It's always safe. That too, when you are having situation like this and you're in a PG and your water source is unknown, you don't know from where the water is coming, then please make sure you boil your water before you take it.
So, ma'am,
That's
how
one thing I really
important
hope so.
is vaccination during the rainy season? And are there
Yes, as I
any?
told you, children and adults, people who are at risk, maybe as I told you, like people who already have issues like asthma, people who already have issues like COPD, kidney issues, on dialysis, people who are HIV and these things. HIV is difficult to take vaccination because vaccination itself can cause a lot of infection in them. People who are on immunosuppression medicines, maybe all of them, plus heart patients, I would say please, please, please go ahead, take your vaccinations.
So, ma'am,
Very
are there any
important.
specific vaccinations that they should take?
The most important thing at this point in time definitely is the flu vaccine, which is because that can prevent pneumonia, and other vaccinations are the general ones which are usually given for children. The normal vaccination protocol will have to be followed. For adults, I would say the most important thing at this time is your flu vaccine. That's it. Yeah.
So, ma'am, as we all know, that the Terminal 2 of Bangalore Airport is leaking and things as such. So, people tend to have this hypertension like while they are in the airplanes. So, the planes were shifted from Bangalore to Chennai. The landings happen in the Chennai. So, things as such tend to, create tension. Excuse me, create tension in the minds of people. So, what do you suggest during times as such?
When you're traveling, make sure your medications are with you. Carry a prescription of the medication that you take, attested by a doctor, because different people have different rules. Carrying medications off the or even off the record, off the shelf, and over the counter can be questionable in airports and in certain places. So carry a prescription of the medication that you're going to carry, and carry all your medications in your hand carry. Don't leave it in your in the luggage, because you could be stranded anywhere. Maybe suddenly your flights will deviate to other airports. Maybe you may have to go somewhere where your luggage will not be accessible to you, and you may not be knowing the place where to go and get your medications. So your
Yes.
medications that you're taking, generally have it with you with a prescription in your hand. That makes it mostly 90% you're safe. At least you have your medications in your hand. And the most common medications used for common things like Calpol for fever, a few medications for vomiting, something for diarrhea. So keep all those in your purse as well. Your purse should not carry much of cosmetics this time. You should carry more of your medicines. It's very, very important. And with that, a prescription to go with. And wherever you keep your medicines, make sure you keep the prescription in the same pouch, so that the people who question you also, you can immediately talk and open the prescription and show the doctor has prescribed the medicines for you, and it's essential for you to carry this in the hand carry. So do that and relax. Don't panic if you are, debating your flight, or if you're missing your flight, or flights are getting delayed and stuff like that. The most important thing is please relax. And I'm sure with this weather conditions, even in the middle, you might be finding turbulence, and there could be issues where you're going to have panic episodes. But I would say just have a deep breath, just relax. Things are going to ease out soon. But be getting panicky and kind of losing the hand can cause you a lot of damage than what the situation could cause. So relax, and people who are post COVID, we are in a generation who have sustained and in fact stayed through COVID. We are strong. That's first thing, but our other organs have kind of, I would say, minimized in function. So very careful that you don't put any pressure on your heart. So don't panic, don't get agitated, don't get irritable. Relax yourself. Carry your medications in a pouch. Carry it in your hand carry with you, and of course keep a bottle of water and enjoy your flight. You'll be fine.
Ma'am, in general times, and especially in times as such, it's very difficult for women to use public toilets, toilets in the airports, toilets on the stations. So, as an healthcare influencer, what would you suggest them to do while they're using public toilets?
The first and foremost thing I would recommend is as soon as you get in the washroom, make sure you have flushed it first before you use it. Very important, because even if the other person has done that, you would have to do it again to prevent any contaminations. And nowadays we have sprays like P Safe and all that, wherein you can just spray them on the toilet seat and use it, kind of conveniently. But even then, I would say try and wipe it off with a tissue paper before you sit on it, and then of course carry out your normal thing, and be very sure that you wash your hands very thoroughly. And after you use a public toilet, very very important for you to wash your hands very thoroughly. Take your time, relax yourself, and make sure you ensure the entire protocol of hand washing, and wash it till your hands are kind of safe and dry. After washing it, make sure you dry it well so that the contamination is free. Very important.
Also, as we all know, that we also tend to buy water bottles which are made up of plastics and things as such.
Right.
And few days back, government came up with this advertisement that we should not directly put the bottles into our mouth, because the material that is available on the bottle can cause
Can be
to see.
recycled. Could
Yeah.
have been
So
recycled. True, true.
yeah. So what would you suggest about that?
Definitely, definitely. It's always safe to drink from, either you take your own glass, carry your glass, there are so many disposable glasses available, or even then you have your own tumbler, there are so many, I would say, foldable tumblers which are available that you carry on your journey as well. So put if you are used to drinking it by biting the tumbler or the bottle, make sure you pour the water in the tumbler and take it how you take it. Keep it on your own ease. Otherwise, of course, the use old method that pouring it above your mouth. Better option. Yeah. Than biting
And
the
ma'am,
bottle. Yeah.
and a general question, being a woman, it came to my mind because, see, during times when we are going through our menstrual cycle, we have this issue of where and how to throw our pads, use
Dispose the
pads.
pads.
Exactly. So, is there a particular way you would suggest that could save
Definitely.
us from
See,
the unhygienic part?
definitely. See, first of all, when we dispose our used pads, we are in fact more responsible for other people than for ourselves. It's
Yes.
something that we would be, we shouldn't be leaving out infections or stuff for the next people who are going to use the washroom. So make sure you cover your pad with either a paper, or the sanitary pads come with a pouch. So make
Yeah.
sure you fold them or roll them into a small roll. Cover it well with the pouch in the thing, and on that I would say safer is cover another newspaper or something, pack it up and then dispose it. So there's so many public toilets when you go. I mean, it's very very strange, and I would say the basic hygiene some people do lack, and they just throw it just like that. They use sanitary pads just lying out there. So this is very unhygienic, spreads a lot of infections, and even I would say even if you are not telling that it's bad to see, it's a natural phenomena. Definitely, it's not bad to see or anything like that, but it's very unhygienic and spread a lot of infections medically, and it can lead to a lot of other issues as well. So I would
True.
recommend people are using it to fold the patch, put in the pouch which is given to you in the. You have your own pouch with the pad, so use that pouch to seal it up and cover it with the paper with a double cover and dispose in the bin. That's the best way of doing it.
So, ma'am, in total, what's the last message that you would like to give to the people watching this?
Take your vaccinations on time, take your medications on time. People who are diabetic, I'm a diabetologist too, so please make sure your sugars are under control. Talk to your doctors to get them to a normal range if they are not. And water source, very important. And if you're unaware of the water source, boil your water and drink it. Avoid street food. Take home cooked food. People who don't have home cooked food can go for the ready-made meals. Boil them in your own home than eating from the restaurants. Avoid eating from the restaurant for this whole week. After that, you can have your time with your family and enjoy yourself. But I would say curtail it for this week when the rains are bad, and pray that things end soon.
Thank you so much, ma'am. It was very
Thank you.
inspirational and thoughtful, and also meaningful for me and the people watching here. Thank you so much
Thank
for
you,
that.
Mehak. Pleasure being here. Thank you so much. Thank you.